You know, it's been so impressive, the change. So when I started in this field 30 years ago, there really exercise was thought potentially to be harmful. There was reports written speech therapy doesn't work, or it could actually be considered controversial because there's no hope that any improvements would last over time. So that was just 30 years ago. And to see the massive amount of change that's happened, the 1990s were really the decade of the brain in the field of neuroscience, and our understanding that of activity-dependent neuroplasticity, brains can change in response to activity, even in people with neurological disorders like Parkinson's. So as that literature began to come out, the interest in really understanding the impact of exercise, physical therapy, speech therapy, occupational therapies exploded. So today, if you come into the field, you would be like, well, of course you have people exercise, of course you refer them, but it wasn't so long ago that that was not the case. So now we have evidence-based physical therapies, evidence-based occupational therapies, evidence-based speech therapies. In addition, we recognize the importance of exercise, the trials that are going on to really understand, can it not only be beneficial just for symptomatic relief, but actually potentially altering the disease progression. If they're diagnosed with Parkinson's, they have deficits in every single area: speech, swallow, gait, activities of daily living. Something got them to the diagnosis. And the neuropharmacological treatments do a lot, but on top of that, exercise, speech, physical, and occupational therapies can give them the best outcome. So we'd like to say upon diagnosis of Parkinson's disease, give the prescription to get, at least if nothing else, a baseline assessment from a speech language pathologist, from a physical and or occupational therapist. Also make those connections to try to get to community-based exercise programs. So we know we have so many: rock steady boxing, pedaling for Parkinson's, dance for PD, ping pong, you know, whatever style of exercise you want to do. But that therapeutic referral is really important. And one that gets missed a lot is speech and swallowing. So we know these changes occur very early, and the deficits may be subtle. And in fact, there's a lot of research looking at voice as a biomarker for early disease detection, because with the sophisticated analysis we can do now in the acoustic signal, we can see changes very, very early. So that means by the time they end up in the neurologist's office, they are having challenges. Now, one of the things we know with Parkinson's is that oftentimes they're not aware of the challenges they're having. So if we simply ask, how's your speech, how's your swallow, all good. And the deficits may be subtle. And in fact, the things they may be experiencing aren't exactly like complete speech breakdown, but they're losing confidence. You know, they'll go out and there'll be a noisy situation, and because their voice has gotten soft, they'll try to contribute to the conversation and people won't hear them. So they just basically get ignored. And so they may not attribute that initially to my voice has gotten soft, but it's hard, and it starts to eat away at your self-efficacy. And it can put people in a vicious cycle of, now I don't want to go out because I don't enjoy it. But maybe they can't pinpoint exactly why, but oftentimes it can be voice. Sometimes, you know, the changes in eating and swallowing are subtle, but again, a loss of confidence means I don't want to do that in public. So getting to the professionals who we've spent our entire careers studying this and just make the referral, then we can be there to at least get a baseline assessment, offer that education, and refer and get people into treatment early. And that exact same thing I would say is true for physical therapy and occupational therapy. Sometimes that's misunderstood and gets left behind, but occupational therapists are genies. They have all these creative ways to improve daily function and make life easier, and tricks and hacks and ways to really improve quality of life for people with Parkinson's. It can diminish burden on caregivers. So refer. Just refer upon diagnosis. That would be our mantra.